and welcome back to the second part of our How to Create an Online Learning Resource webinar. The second part is all about how, and we start with define. Define is the first D in our step-by-step method for how to create meaningful and effective learning. So what do we mean by this? We would like you to define in the first instance, what is the topic and scope? Secondly, what are you trying to achieve? And thirdly, who is your target audience? So let's start with topic and scope. The topic and scope depends a little bit on what you are after. Are you in a position, which not many of us are, to define a whole curriculum? Or are we just after answering one question? And to illustrate that, I've modeled this after the taxonomy we use to explain and categorize the animal kingdom. So in my example, my topic is diagnostic imaging. Now, obviously, I think it's the most important topic and should have play a big part in a whole curriculum. However, today, I'm not here to design a whole curriculum. I'm going to go down the taxonomy and say, right, okay, I'm after ultrasound. I'm after ultrasound of dog. I'm specifically interested in ultrasonography of the abdomen. And here I want the learner to know more about the ultrasound of the liver. And largely, really, I'm going to take it down to one only topic. And this is the ultrasonographic anatomy of the normal liver. So depending on whether you want to design a whole course, a whole curriculum, or just answer one question, you design your course. So define your topic and scope. Define right from the beginning, what exactly are you trying to achieve? So this is often called the learning gain, also sometimes the learning aim or the learning outcome. And ideally, you define this for the individual learner, but also for the business and the community. So I have two examples for each of them here. So for the individual learner, an example would be, and this is for an online course I've created for radiographing horse leg. So the aim of this course is to equip the learner with the knowledge and skills to take radiographs of the horse's front leg in a safe manner. On the business side, the example would be the aim of this course is to reduce the number of radiation safety related incidences. So let's stop here and you take over and you define the topic, the scope, the overall learning outcome for the individual as well as the community for the course you want to create. Secondly, we need to define the learning objectives. The learning objectives are the little bits, the little goals that we need to achieve to reach our overall learning outcome, our overall aim. And these should follow the SMART principle. They should be specific, measurable, attainable, relevant, and timely. Depending on the size of the course, keep the number to a manageable level. 1 to 5 is usually a good number. And the learning objectives can be categorized according to the difficulty. And Bloom has produced a taxonomy here. So this is Bloom's taxonomy. So thank you to Fractures Learning for letting me use this. And we're starting at the bottom. That's the lowest hanging fruit. That's knowledge transfer. We want our learners to remember something. And in the purple level, in the purple field at the knowledge level, you will find words that go with that, that help you formulate learning objectives at this level. One level up is comprehension. We want the learner to actually demonstrate that they have understood the facts and not just be able to regurgitate them. And again, in the blue field, you will find words that go with that. And then a level up is application. And this is really where this is the bread and butter for anyone who wants to create a clinical course. Here is, we want the learner to apply their knowledge to actual situations. And that's what we want our learners in the veterinary field to do. They will have to deal with cases, and we want them to use their knowledge, what they have learned in the lower levels, to do that. And then it goes high up. analysis, synthesis, evaluation. Of course, we want to push our learner to that, and it's especially important once you get to postgraduate level. PhD students even have to go a step further. They not only have to evaluate, they also have to create their own knowledge. So here I have an example for you for the equine radiography course. So an example for to gain knowledge, so the lowest level would be on completion of this course, the learner will have gained knowledge in radiographic anatomy of the horse leg. One step up, to apply this knowledge, on completion of this course, the learner will be able to identify which radiographic projection to use when a horse shows the following clinical signs. So obviously, the learner at this level already needs to have gained knowledge about anatomy and also about physics, how a beam travels, but also about the clinical presentation of different problems. And I've also put in this particular course, comply. On completion of this course, the learner will understand the importance of radiation safety and act accordingly. And to get people to comply with things, to change their behavior, that's high-hanging fruit. That's often tricky, especially if you imagine the rather sometimes laissez-faire attitude of equine vets to radiation safety. That's a tough call to change that behavior. But hey, we'll try. So I would like to ask you now to stop the video here and define up to 5 learning objectives for the course you are planning to create. Last but not least, we need to define the target group. We need to characterize our learners. Demographics. What age are they? There is different preferred communication methods. My generation, we are email people. We do Facebook, we do WhatsApp, but really main preferred communication method is email. That is different in younger generations. So have a think. What is the age of your target group? Diversity. What learning differences do you expect? Gender. Males are more into gamification than females. Obviously, the background plays a big role. What type of expertise do they bring to the table? What is their existing level of expertise? Are you planning a course for beginners? Are you planning a course for at intermediate level? Is it going to be undergraduates first year, undergraduates final year? Is it going to be for new grads up to 1 year out, or is it going to be for really experienced vets that are 10 years qualified? Technology. What tech skills do your learners have? What experience with and what attitude towards digital learning do they have? And what technology is available to them? Hardware, internet speeds, software. What do they need? What can they get? And big, big question to ask is time. How much time will they able to afford to allocate to your learning outcomes? And when? When can they do their learning? Now, time available, it's a bit of a chicken and egg problem because every content experts think their subject is the most important. We have the desire to impart all our knowledge, but please reduce it to concepts. It really makes sense to reduce the detail. Think about what else they have to learn. Make it manageable for them. The shorter, the better, really. What is your target audience's work pattern? For example, if you want to create a course for ambulatory equine vets, they spend a lot of time in the car driving from patient to patient. So audio files, podcasts are very good for them. Or would they be after 90-second clips? Are they small animal vets who have a little bit of time between consults and just want to look up how to do a certain procedure really snappily? Then you produce bite-sized learning. So characterize your target group as your next task. So this brings us to the end of define. In the next part, in the next video, we will to look at part 3, how to design your online learning course. So see you back in a little while.